Families of mine workers who lost their lives in a horrific crash in Musina will today begin the process of identifying their bodies at Tshilidzini Hospital. Limpopo Health MEC Dr. Phophi Ramathuba and MEC for Social Development Dr. Nandi Ndalane are there to support the families. Ramathuba has expressed sadness, saying this is a difficult period for the victims' families, as well as the department.
The pain that we are going through, it's not only the pain that the family is going through. It is a difficult period for us. I met with our pathologist also. This is very difficult. It's a tough period for them. They were saying to me, MEC, at the end of the day, while we are forensic pathologists, but we are equally human beings, and the pain that we are going through, when you look at these charred bodies, when you look at them, and you know, it affects you. That is why we had reinforced our team of clinical psychologists. You can see I'm with the MEC for Social Development. We have mobilized enough social workers so that we try to do the debriefing. To some people, they have not yet, it has not yet come to reality, because grieving as a process, to some start with denial, then acceptance, and we are still going to have to do a lot of work even post the funeral.
Newzroom Afrika's Nqobile Madlala is in Limpopo and joins us now to give us an update. Nqobile, just quickly keep us up to speed as to exactly what is happening. I can imagine really tough times for the family members of the victims of the crash.
Well, a very difficult one indeed. In fact, we've seen the families break down inside, crying because of what they've seen, and they're yet to see as well. Just the fear and the understanding that they've lost some people that are breadwinners in these families. It's been very difficult for them. But Gwena, I've got two people that are currently here who can speak on behalf of the families as well. The gentleman that joins me now lost a son. And of course, he was saying to us that the son was a breadwinner. He has 3 kids, and this of course is difficult for his family. Baba, siyazi ukuthi lokho okwenzakalile kubuhlungu kakhulu kumndeni. Ungasitshela nje ukuthi uzizwa kanjani njengamanje njengani la?
Kubuhlungu kimi. Kubuhlungu kukhona. Kubuhlungu kakhulu mona gore are kilovile. Kilovile. Gore ke tsore ngalo botsa gore nkare gona no ke batho ba tseba gore ke na le ngwana a sa le ke lovile kudu a ke tseba nna ke nkareng kwa fuku.
Baba, ubusitshela ukuthi ubhuti lo odlulile unezingane ezintathu. Yebo, ungasichazela nje ukuthi njengamanje ubuhlungu ezwela bona?
Bana ba gago ba ile thushe ke mang, ba ile go disha ke mang ka re nna ke fedile moseklempon ke mtala jalo bana ba gago ba ile go disha ke mang ka yena se gona ka re bana ba tlamele ba go dishikene a ba gele dintlo a ba rekele se a ba tsentse dikolo jalo go ke mang a tlo tswela pele ka moshumo moshumo boima ko ba godisha a ba tsentse sekolo gore batho ba kgone go itirela fela ba sala ba bannyane, so go botlhoka kudu ka Limpopo gane jale re swere mo ke tšeletša re tswa go di-DNA no ba go tletse kwa gae batho ba nyako tseba gore na go diregana. Nako nngwe ka tla re tšea nako yone batho ba nyaka go fela ba mongwe ba ena metsi ba ile rekela ke mang metsi ka re mongwe wa ntsebe a sa nne re thusha a sa le go go botlhoka kudu. Nna re tlo tšeang ra bere ge batho ba tšwelela gore o ka re o tla phula mo fatshe wa tsena o tsebe gore na go diregalang. Go botlhoko ge batho ba tšwelela go tlo ba botšang ba tlo nwa metsi ba gore ga go kgone go wa tšea kae metsi ka re metsi le ona a rekiswa.
Well, as you can hear, they're going a very difficult time for this family. He's just explaining to us that this gentleman was a breadwinner. There are people that are currently going to their homestead to sort of pay their respect and also find out what is happening. And he says this is very difficult. What are they going to say to the people, and what are they going to give to the people? He's a pensioner and now he's expected to be taking care of 3 kids. And he says that his son was the one that was paying for everything, and this now has occurred. And of course, there was a representative that spoke on behalf of all the people that were there, of the families. And I mean, earlier on you were touching on the fact that, as Ubaba was explaining now, that these are breadwinners and there needs to be a solution going forward so that there is a way that these families can still afford, even post this traumatic or this tragedy. Tell us, what are those solutions that you were putting in place?
No, thanks, ma'am. And I think what we are suggesting is that both the employers, Marian Robert as well as DBS, to consider looking into the families first before they can go outside in their attempt, or as they will be replacing all the deceased. We think that will go a long way in ensuring that the gaps that are left by the deceased are going to be closed. I think it is not too much for us to ask, and especially for the skills that we think they'll still be within the families that are, or the family members that are still remaining, just to ensure that at least there'll still be bread on the table for the families to continue being able to live.
And of course, being a representative for these families, you get to speak to them closely and sort of hear the issues that they faced with. What are they saying to you? This is tragic.
No, there is a lot. The major one is this one, especially as my father, who spoke before me, have said it, that economically it is living a very serious tenth, but also mainly in preparations for the burial. We request the employers to assist, to jump in and assist in whatever way they can, so that we can be able to bury our brothers and sisters and all the family members in peace, without having to incur a lot of stresses as to how are we going to ensure that we cover all the costs, in particular that relates to the funeral arrangements.
Did you know any of the people that passed away?
Yes, the one that I came with is my brother-in-law, but he also had friends that from time to time we'll talk to. So we know, but there is just one common factor amongst them. They had multiple families that they were taking care of them. Not only their own children, but they have their sisters who got children that they were taking care of them. They've got extended families that they were taking care of them. So this strategy is really a pain to ourselves.
Thank you very much for speaking to us. Well, I think it's very difficult for these families, and what you see behind me is the area where they are now going in to sort of carry on with that DNA process. We have heard that about 5 of the families are able to come in here, as they have said now that 5 of those bodies are in fact ones that you can look at, but other than that, it's very difficult for them to ask the families to come and go through what is happening here. So it's very, very difficult for these families. A lot of them have broken down. A lot of them have cried, and you can hear this. It's very difficult economically for them, because they are taking care of these various families, extended families. So they're asking for solutions. That family representative saying that they're asking for solutions, but a lot of these families are really just heavily affected, and they looking to these companies to come up with solutions that can assist them, but also with this traumatic experience to be able to be counseled, because this is something that's very difficult indeed for families to face.
Nqobile, we heard Dr. Phophi Ramathuba speaking earlier on. I mean, has government mentioned anything in terms of assistance going forward as yet?
Well, what we know right now is that they are still going through the processes, and the first process, of course, is to identify who are the individuals and also to know how far they live from here. So hence, they had to bring in the families. So once that process is done, then they're able to understand which province they could be coming from. We know that so far they've said about 3 people out of the people that are here are from Limpopo and in and around here, which means then they can speak to the local government for assistance in the various structures that are around that can potentially assist them in terms of social development, in terms of also economically, in terms of assisting with the burial and so on. But they're saying that they first need to understand where these individuals are coming from, because say, for example, one was coming from another province, they need to reach out to those provinces and see how the structures within those provinces can also club in and assist. So this is what's going to happen, and we understand that this process is most likely going to take them at least 2 weeks. So there's quite a long time and a lot that they still need to go through before they are able to decide what exactly each individual needs. But from the mine itself, they also did say that they are going to speak to each family and ask them what they need, and they will provide to how best they can assist that each individual or each family.
Nqobile, we're going to have to leave it there, but thank you very much for keeping us up to speed. That is Nqobile Madlala keeping us up to speed with that incident in the Limpopo province.